Hey everyone, Dr. Mike Varshevsky here. Today, we're going to talk about a condition that can be a bit of a medical mystery at first glance. It's called reactive arthritis. You might have also heard it called Reiter's syndrome, though we'll get into why that name isn't used as much anymore. So, what is it? In simple terms, reactive arthritis is a type of arthritis that develops in reaction to an infection somewhere else in your body. It's not the infection itself that gets into your joints. Instead, it's your own immune system which, after fighting off a bug, gets a little confused and starts attacking your healthy joints and tissues. It's an autoimmune response, a case of friendly fire from your body's own defense team. Imagine your body has just won a battle against an invading bacteria, maybe in your gut or your urinary tract. The battle is over, the germs are gone, but the alarm bells are still ringing. Your immune system, still on high alert, mistakenly identifies your own joint linings or even your eyes as a threat. This triggers inflammation, leading to pain, swelling, and stiffness. This reaction is what gives the condition its name. It's your body reacting to a past infection. It typically shows up about 1 to 4 weeks after you've recovered from the initial illness. This condition is part of a family of arthritic diseases called spondyloarthropathies, which also includes conditions like ankylosing spondylitis and psoriatic arthritis. What they all have in common is a tendency to cause inflammation in the spine and other joints. Now let's talk about the name. For a long time, this condition was widely known as Reiter's syndrome. You might still see this term in older medical texts or hear it used by some people. The name came from Dr. Hans Reiter, a German physician who described a soldier in World War I with the classic trio of symptoms, arthritis, urethritis, and conjunctivitis, after a bout of dysentery. However, history is rarely that simple. As time went on, more information about Dr. Reiter's past came to light, and it was deeply troubling. It was discovered that he was an active member of the Nazi Party and was involved in horrific and unethical medical experiments on prisoners in the Buchenwald concentration camp during World War II. His actions were a profound violation of medical ethics and human rights, casting a very dark shadow over his legacy and by extension the name of the syndrome. This created a significant ethical problem for the medical community. In response to these revelations, medical organizations and patient advocacy groups around the world began a push to change the name. It was felt that continuing to use Reiter's syndrome inadvertently honored a man whose actions were condemnable. So, the name reactive arthritis was officially adopted and is now the preferred term. It's not only more ethically sound, but it's also more descriptive and accurate. It tells you exactly what the condition is, arthritis that is a reaction to something else. So what actually pulls the trigger for reactive arthritis? The root cause is always an infection, but not just any infection. The culprits are specific types of bacteria. These infections typically happen in one of two places in your body: your gastrointestinal tract, which is your gut, or your genitourinary tract. When it comes to GI infections, the common offenders are bacteria you might get from contaminated food or water. These include Salmonella, which you often hear about in relation to raw eggs or chicken, Shigella, a cause of dysentery, Yersinia, which can be found in undercooked pork. When one of these bacteria sets up shop in your gut, your immune system launches a full-scale attack. In most people, that's the end of the story. But in a small subset of individuals, this immune response goes haywire and leads to reactive arthritis. The other major source is sexually transmitted infections, specifically from a bacterium called Chlamydia trachomatis. This is one of the most common STIs, and it often causes very mild symptoms or no symptoms at all, especially in women. Scientists believe that genetics play a huge role here, particularly the presence of a gene called HLA-B27. About 75% of people who develop reactive arthritis have this genetic marker. Think of the HLA-B27 gene as predisposing your immune system to overreact. The infection is the spark, but the gene is the kindling. Without that genetic predisposition, your immune system is much more likely to just clear the infection and go back to its normal, quiet state. When we talk about the classic presentation of reactive arthritis, doctors often refer to a triad of symptoms. This triad is a combination of 3 specific problems that tend to show up together, although it's important to know that not everyone will experience all 3. The classic phrase you might hear is "can't see, can't pee, can't climb a tree." It's a memorable, if a bit blunt way to describe the 3 core areas affected: the eyes, the urinary tract, and the joints. The first and most defining symptom is the arthritis itself, the can't climb a tree part. This typically involves pain, swelling, and stiffness in the joints. Unlike some other forms of arthritis, it's often asymmetric, meaning it affects joints on one side of the body more than the other. The joints most commonly affected are the large ones in the lower body, like the knees, ankles, and feet. You might also experience significant pain in your heels, a condition known as plantar fasciitis, or in your Achilles tendon. Next up is the can't pee part, which refers to inflammation in the genitourinary tract. In men, this often presents as urethritis, which is inflammation of the urethra. This can cause a burning sensation during urination, an increased urge to go, or a discharge from the penis. Finally, there's the can't see component, which involves the eyes. The most common eye issue in reactive arthritis is conjunctivitis, also known as pink eye. It can make your eyes red, watery, and gritty, as if you have sand in them. While the classic triad of symptoms is a key indicator, reactive arthritis can cause a wide range of other issues throughout the body. One common area affected is the skin. Some people develop skin rashes. A characteristic type is called keratoderma blennorragicum, appearing as small, painless, waxy-looking blisters on the soles of your feet and palms. You might also develop painless sores in your mouth or on your tongue. Additionally, your fingernails and toenails can become thick, brittle, or crumbly, another sign that can be easily mistaken for a fungal infection but is actually part of the inflammatory process. Another significant symptom that many people experience is profound fatigue. This isn't just feeling a little tired, it's an overwhelming sense of exhaustion that isn't relieved by rest or sleep. This fatigue is a direct result of the body-wide inflammation. The inflammation can also target the places where tendons and ligaments attach to bone, a condition called enthesitis. The most common site for this is the heel, causing either Achilles tendonitis or plantar fasciitis. In some cases, people develop what's known as sausage digits or dactylitis, where an entire finger or toe swells up looking like a little sausage. This is due to inflammation of the tendons running along the digit. Diagnosing reactive arthritis can be a bit like detective work. There isn't a single definitive test that can say, yes, this is reactive arthritis. Instead, your doctor has to gather clues from different sources: your medical history, a physical exam, and various lab tests. The doctor's first and most important tool is listening to your story. They'll ask detailed questions about when your symptoms started, which joints are affected, and if you've been sick recently. The physical examination is the next critical step. Your doctor will carefully examine your joints, looking for signs of inflammation like swelling, redness, warmth, and tenderness. They'll check your range of motion to see how much the arthritis is limiting your movement. They will also look for checking your eyes for conjunctivitis, examining your skin for rashes, and looking at your fingernails. They may also check for tenderness where tendons attach to bone, like at your heel, which is a key sign of enthesitis. This head-to-toe examination helps the doctor see the full pattern of the disease. Next, your doctor will likely order a series of tests to gather more evidence. Blood tests are common. They can check for markers of inflammation in your body, such as the C-reactive protein and the erythrocyte sedimentation rate. Your blood may also be tested for the HLA-B27 genetic marker. Finally, the doctor will need to look for evidence of the triggering infection. This might involve taking a urine sample or a swab to test for chlamydia, or a stool sample to test for bacteria like salmonella. Once a diagnosis of reactive arthritis is confirmed, the focus shifts to managing the symptoms and treating the underlying inflammation. The treatment plan is usually multifaceted, combining medications, physical therapy, and lifestyle adjustments. If the triggering infection is still active, for example, if you test positive for chlamydia, the first step will be a course of antibiotics to clear it up. However, antibiotics will treat the infection but won't cure the arthritis itself. The mainstay of treatment for the arthritis symptoms is non-steroidal anti-inflammatory drugs, or NSAIDs. You're probably familiar with over-the-counter versions like ibuprofen, Advil or Motrin, and naproxen, which you might know as Aleve. Your doctor will likely prescribe stronger prescription-strength versions to get the inflammation under control. If NSAIDs aren't providing enough relief, your doctor might recommend corticosteroid injections. A powerful anti-inflammatory medication like cortisone is injected directly into a swollen joint. This can provide rapid and significant relief that can last for several weeks or months. For people whose reactive arthritis becomes chronic and doesn't respond well to other treatments, disease-modifying anti-rheumatic drugs, or DMARDs, may be needed. Medications like sulfasalazine or methotrexate work by suppressing the overactive immune system. More recently, biologics, which target very specific parts of the immune response, have been used successfully in severe cases. These treatments are typically managed by a rheumatologist, a specialist in arthritis and autoimmune diseases. Living with reactive arthritis requires a proactive approach to managing your symptoms day to day. It's about more than just taking medication, it's about learning to listen to your body and finding strategies that help you feel and function better. One of the most important things you can do is find the right balance between rest and activity. A physical therapist can be an invaluable partner in your care, designing a customized exercise program that focuses on maintaining range of motion and strengthening muscles. Activities like swimming or water aerobics are often excellent choices because the water supports your body weight, taking the pressure off your painful joints while still allowing you to move and build strength. Managing pain and stiffness at home is also key. Many people find that applying cold packs to swollen, inflamed joints can help reduce swelling and numb the pain. For chronic stiffness, a warm shower or heating pad can help relax muscles and ease discomfort. Finally, don't underestimate the power of a healthy lifestyle. Eating a balanced, anti-inflammatory diet rich in fruits, vegetables, and omega-3 fatty acids can support your overall health. Getting enough sleep is critical, as this is when your body does most of its healing. Finding healthy ways to manage stress is an essential part of your wellness plan. To wrap things up, reactive arthritis is a complex and often challenging condition, but it's one that we understand much better than we did in the past. It's a clear example of how an infection can trigger a misguided immune response, leading to inflammatory symptoms that can affect your joints, eyes, skin, and more. The classic triad of arthritis, urethritis, and conjunctivitis is a major clue, but the disease can present in many different ways. The journey to a diagnosis can sometimes be long, but requires careful detective work from your doctor. While there is no single cure, we have a very effective arsenal of treatments available. From NSAIDs and steroid injections to more advanced DMARDs and biologics, these therapies can successfully control inflammation, relieve pain, and help prevent long-term joint damage. The prognosis for most people is good, with many experiencing a full recovery within a year. Living with reactive arthritis means becoming an active participant in your own care, partnering with your healthcare team to find the right treatment plan. Most importantly, if you experience a sudden onset of joint pain, especially if it follows a recent stomach bug or urinary symptoms, don't just wait for it to go away. Talk to your doctor. Early diagnosis and early treatment are your best defense. Getting the inflammation under control quickly can significantly improve your outcome, reduce the severity and duration of your symptoms, and lower your risk of the condition becoming chronic. Be your own health advocate. Pay attention to your body's signals and seek medical advice when something feels wrong. It's the most powerful step you can take.